everyone, welcome back to NORCET with Jaspreet. This video is about placenta and umbilical cord. So in this video, we are going to discuss the important aspects of placenta as well as the umbilical cord. So here it starts, right? So if we talk about placenta, placenta is the connection between the developing fetus and the maternal body. ठीक है, मदर और बेबी की बॉडी में जो कनेक्शन डेवलप होता है वो प्लेसेंटा के थ्रू डेवलप होता है. So in this video we are going to discuss the important aspects related to placenta as well as the umbilical cord. So first thing is that if we talk about placental weight is nearly 500 grams as well as volume which is 500 ml. ठीक है, this is volume. अगर हम वेट की बात करें, प्लेसेंटा एट टर्म वेज अबाउट 500 ग्राम्स एंड द वॉल्यूम इज 500 ml. ठीक है, बट अगर हम वेट विद रिस्पेक्ट टू द फीटल वेट देखें तो उनका रेशियो होता है 1/6. ठीक है, इट स्टेट्स दैट वेट ऑफ प्लेसेंटा इज 1/6 द वेट ऑफ फीटस. ठीक है, फीटस के वेट के 1/6 होता है वेट ऑफ प्लेसेंटा. ठीक है, नाउ इफ वी टॉक अबाउट 3 टर्म्स दैट आर एसोसिएटेड विद द टर्म प्लेसेंटा. जब हम प्लेसेंटा को डिस्क्राइब करते हैं वी यूज 3 टर्म्स. वन डिस्कॉइड, सेकंड द हेमोकोरॉयल एंड थर्ड इज डेसिडुआ. ठीक है, द प्लेसेंटा इज डिस्कॉइड. डिस्कॉइड मींस इट इज डिस्क शेप्ड. इट इज डिस्क शेप्ड. ठीक है, hemocoral means it is receiving the blood from the maternal body. ठीक है, and the decidua means it will shed along with decidua. So here are the 3 terms that are being used to describe the placenta. First is discoid, hemocoral and the decidua. ठीक है, ये 3 टर्म्स है जो प्लेसेंटा की एनाटॉमी को डिस्क्राइब करती है. ठीक है, कि इसकी शेप इज डिस्क शेप्ड, इट इज रिसीविंग द ब्लड फ्रॉम द मैटरनल बॉडी एंड एट द टाइम ऑफ डिलीवरी इट इज शेडिंग along with the decidua, and decidua is the endometrium of the pregnant female uterus. ठीक है, and what is decidua? Decidua is a term that we use for the endometrium of a pregnant uterus. ठीक है, एक प्रेग्नेंट फीमेल का जो यूट्रस की एंडोमेट्रियम लेयर होती है दैट इज व्हाट वी कॉल एज डेसिडुआ. ठीक है, व्हिच इज गोइंग टू शेड एट द टाइम ऑफ डिलीवरी. नाउ मूविंग ऑन टू द नेक्स्ट, इफ वी टॉक अबाउट द नेक्स्ट की कांसेप्ट रिगार्डिंग द प्लेसेंटा. जो प्लेसेंटा होती है उसकी 2 साइड्स होती है. वन इज द मैटरनल साइड एंड अदर इज द फीटल साइड. ठीक है, एक होती है मैटरनल साइड एंड एक होती है फीटल साइड. इफ वी टॉक अबाउट द मैटरनल साइड, जो मैटरनल साइड होती है वो 1/5 ऑफ द प्लेसेंटा को कंप्राइज करती है. इट इज डल इन कलर. ठीक है, इट इज डल इन कलर विद cotyledons. Cotyledons are present. And from where it is originating? It is originating from the decidua basalis. And about this decidua basalis we have discussed in the previous video, right? So you may find the link of that video in the end screen, right? If we talk about the fetal side, जब हम फीटल साइड की बात करते हैं इट इज कंप्राइजिंग ऑफ द 4/5 ऑफ द प्लेसेंटा. इट इज शाइनी एंड इट इज ओरिजिनेटिंग फ्रॉम द कोरियोइड फ्रॉन्डोसम. ठीक है, वो मैटरनल साइड जो है वो डेवलप कहाँ से हो रही है? डेसिडुआ बेसालिस से. एंड द फीटल साइड इज डेवलपिंग फ्रॉम द कोरियोइड फ्रॉन्डोसम. ठीक है, बेसिकली दिस वाज अबाउट द 2 साइड्स. अगर प्लेसेंटा की एक साइड मैटरनल साइड है वो डल होगी, उसमें कॉटिलिडन्स विल बी प्रेजेंट. ठीक है, बट इफ वी टॉक अबाउट द फीटल साइड, जो फीटल साइड होगी वो डार्क कलर्ड होती है एंड कॉटिलिडन्स आर नॉट प्रेजेंट. इट इज शाइनी, राइट? इफ वी टॉक अबाउट द नेक्स्ट पार्ट, देयर आर सम एब्नॉर्मैलिटीज. ठीक है, अब एब्नॉर्मैलिटीज क्या है रिलेटेड टू द प्लेसेंटा? ठीक है, फर्स्ट इज प्लेसेंटा सुक्रेंशिएटा. नाउ व्हाट हैपेंस इन प्लेसेंटा सुक्रेंशिएटा? A part of placenta will get separated from the main placenta, but it will remain connected through the network of blood vessels, right? What happens is a part of placenta will separate from main placenta, but this placenta will remain connected with the help of some network of blood vessels. कुछ huge blood vessel. Suppose this is the main placenta. A part of the placenta will get separated away from it, but it will remain connected to it by the network of blood vessels. This type of placenta is called as placenta subcutaneata. ठीक है? And this separated part of the placenta is called as pleurs. It is called as subcutaneata, and this separated part of the placenta is called as subcutaneata lobe. Right? It is called as subcutaneata lobe. But the thing is, it will remain connected. And जो separated part है, जो part of the placenta जो separate हो गया है, it is called as subcutaneata lobe. ठीक है? This is called as subcutaneata lobe. ठीक है? Basically हुआ क्या? Main placenta से एक part separate हो गया, and it formed the subcutaneata lobe, but that part will remain connected to the main placenta, and this was what we call as the placenta subcutaneata. ठीक है? I hope it is clear. Now, if we talk about the placenta spuria, it is somewhat similar to placenta subcutaneata, but इसमें भी क्या होता है? A part of placenta will get separated away from the main placenta, but there will be no connection by the virtue of the blood vessels. ठीक है? Main placenta से एक part separate हो जाएगा, but कोई connection established नहीं होगा between the separated part of placenta. That is what we call as placenta spuria. ठीक है? Placenta और जो लोब बनी है उसमें there will be no established connection with the help of blood vessels. That is what we call as the placenta spuria. ठीक है? अगर हम next term की बात करें, which is the battledore placenta. ठीक है? Normally क्या होता है? There is a central insertion of the cord. ठीक है? What happens is, if this is placenta, उसके central part में the umbilical cord की insertion होती है. ठीक है? The umbilical cord is inserted in the center of the placenta under all set of normal conditions. But what happens in the battledore placenta? There is lateral insertion of the umbilical cord. ठीक है? Basically, there is the lateral insertion of the umbilical cord. उसको क्या बोलते हैं? Battledore placenta. कि central insertion of the umbilical cord ना होके there was a lateral insertion of the cord. That is what we call as a battledore placenta. ठीक है? अभी तक हमने 3 placental abnormalities पढ़ी. Placenta subcutaneata, placenta spuria, and the third is the battledore placenta. I hope these 3 abnormalities are clear to you all. Now moving on to the next. If we talk about the next thing, the next important aspect of this video is the umbilical cord. ठीक है? अब umbilical cord के बारे में what are the major things that you must remember? First thing about the umbilical cord is that you should know the length. It is 33 to 100 centimeters. अगर 33 से छोटी cord होती है, it is called as a short cord. At more than 100 centimeters, it is called as a long cord. But exam में पूछी जाती है average length. Average length is 55 centimeters, which is the average length. ठीक है? अब what happens is umbilical cord के ऊपर एक connective tissue होता है. That gives it a very smooth texture. Slippery बनाता है इसको जो. That connective tissue is known as the Wharton's jelly. ठीक है? उस connective tissue को क्या name दिया गया है? Wharton's jelly. This is what you need to memorize. ठीक है? अब developmental phases के time पे क्या होता है? Umbilical cord में 4 blood vessels होती हैं. 2 right, 2 left. Right umbilical artery, right umbilical vein, left umbilical artery and left umbilical vein. ठीक है? इसमें कितनी vessels है? 4 at the time of development. But later on what happens is जो right umbilical artery होती है, it gets diminished. ठीक है? तो ultimately कितनी vessels बचती हैं? Right umbilical vein, left umbilical vein and 1 umbilical artery. 2 veins and 1 artery is left behind. Right? So up till now we have studied all the 3 abnormalities related to the placenta. So in this video we are just going to discuss about the placenta and umbilical cord as we have already discussed. So now the part of placenta is over. Now we are going to move on to the part that is related to the umbilical cord, right? If we talk about the umbilical cord, सबसे पहले you should know that the length of the umbilical cord is 33 to 100 centimeters and less than 33 centimeters जो cord होती है, it is called as a short cord. ठीक है? If we talk about the average length of the umbilical cord, it is 55 centimeters, which is the most like common question asked, right? कि average length of the umbilical cord कितनी होती है? It is 55 centimeters. The connective tissue that is covering the umbilical cord, it is called as the Wharton's jelly. This is also very important. ठीक है? You should know what is Wharton's jelly. Basically, Wharton's jelly क्या होता है? Connective tissue होता है that covers the umbilical cord. ठीक है? So उसके बाद important aspect आता है that is related to the blood vessels which are lying inside the umbilical cord. ठीक है? Umbilical cord में developmental phases के टाइम पे 4 vessels होती है. ठीक है? Right umbilical vein, right umbilical artery, left umbilical artery and left umbilical vein. ठीक है? 4 blood vessels होती है. But during the course of development जो right umbilical vein होती है वो disappear हो जाती है and umbilical cord में ultimately कितनी blood vessels रह जाती है? 3. 2 arteries and 1 vein. ठीक है? कितनी vessels रह गई? 3 vessels. Right? The next thing is that the insertion of the cord. Primarily जो umbilical cord होती है, as I've already discussed, कि वो placenta के central aspect में होती है connected. That is what we call as a central insertion of the cord. ठीक है? What is battledore insertion of the cord? Battledore insertion of the cord होती है कि जो placenta के ऊपर umbilical cord का attachment है, it is on the lateral side. Like I can show it to you like this. बेसिकली क्या हुआ, इफ दिस इज प्लेसेंटा, अगर तो उसके सेंट्रल रीजन पे अम्बिलिकल कॉर्ड अटैच हुई, दिस इज कॉल्ड एज द सेंट्रल इंसर्शन ऑफ कॉर्ड. बट व्हेन दिस इंसर्शन ऑफ द placenta, but when the insertion of the umbilical cord to the placenta is towards the lateral aspect, this is called as the lateral insertion. And what we call it as, this placenta will then be called as the battledore placenta. ठीक है? I hope it is clear कि central insertion of the cord क्या होती है और battledore insertion of the cord क्या होती है. Central मतलब mid point में connected होगी जो umbilical cord होगी placenta की, and in the battledore there is a lateral insertion of the umbilical cord. Now moving on to the next. अभी हमने बात करी कि ब्लड वेसल्स कौन सी होती हैं अम्बिलिकल आर्टरी अम्बिलिकल कॉर्ड में. वी हैव 2 आर्टरीज एंड 1 वेन. एंड हाउ अम्बिलिकल कॉर्ड इज कनेक्टेड टू द प्लेसेंटा? इट कैन बी सेंट्रल इंसर्शन ऑफ द कॉर्ड और द लेटरल इंसर्शन ऑफ द कॉर्ड, राइट? द नेक्स्ट इज द वेलामेंटस इंसर्शन ऑफ द कॉर्ड. वेलामेंटस इंसर्शन ऑफ द कॉर्ड का मतलब होता है द अम्बिलिकल कॉर्ड इज कनेक्टेड टू द प्लेसेंटल मेम्ब्रेन्स. ठीक है? द अम्बिलिकल कॉर्ड is connected to the placental membranes. ठीक है? जो umbilical cord है वो placental membrane से क्या है? Connected है. That type of insertion will be called as the velamentous insertion of the cord. जब umbilical cord placental membrane से connected है. So now what complication can arise if the placenta is being connected to umbilical cord with the help of membranes? That can lead to a very complicated condition that is called as a vasa previa. ठीक है? उसको क्या बोलते हैं? vasa previa. ठीक है? The next important aspect of this video is going to be the amniotic fluid. If we talk about the amniotic fluid is basically something which is very important from the NORCET point of view. You should know some key points that are related to the amniotic fluid, which I will be discussing now. Now, first thing is that the amniotic fluid का specific gravity, it is 1.008 to 1.025. ठीक है? pH, it is nearly 7.45. Volume at term it is 600 to 800 ml. ठीक है? तो बेसिकली amniotic fluid एक fluid होता है which is present and it is providing which is acting as a shock absorbent, right? It is safeguarding the baby from any kind of trauma. ठीक है? So basically if we talk about the composition of the amniotic fluid, इसमें 98 to 95 99% it is comprising of water. The remaining 1% is the inorganic and organic solids. Inorganics like sodium, potassium, chloride. And if you talk about the organic solids, it can be urea, it can be uric acid. ठीक है? But basically 99% इसका composition is water, right? Moving on to the next. The next thing is that अगर हम amniotic fluid के origin की बात करें, the origin of the amniotic fluid is divided as the early, the trimester 2 and after 20 weeks. जो early phases में amniotic fluid बनता है, it is from the maternal plasma. It is basically the ultrafiltrate of the maternal plasma. ठीक है? It is the ultrafiltrate of the maternal plasma. Trimester 2 में fetal skin and trimester 3 में it is the fetal urine. But you should know that main contributor to the amniotic fluid production it is fetal urine. Fetal urine ही after 20 weeks produce कर रहा है amniotic fluid, and this is the main contributor of the production to the amniotic fluid. Basically होता है कि amniotic fluid develop होता है, fetus will swallow it and fetal will urinate. This is how it is being balanced. ठीक है? जितना fetus will swallow उतना there will be the production of the amniotic fluid. ठीक है? So basically what happens is after 20 weeks the main contributor of the amniotic fluid is fetal urine. ठीक है? After that, if you talk about its color, at term it is straw colored. ठीक है? But what are the abnormal colors? अब ये color से सबसे ज़्यादा questions पूछे जाते हैं. If the color of the amniotic fluid it is golden, it indicates RH incompatibility. If it is saffron, it indicates a post-dated pregnancy, right? If it is green color, it means a fetal distress or it is meconium stained, right? Tobacco colored, it is intrauterine death, and if it is dark red color, it indicates an antepartum hemorrhage. ठीक है? ये different colors हैं that signifies the abnormalities. ठीक है? अगर suppose green color amniotic fluid है, that means there was a fetal distress, and there is that amniotic fluid is like meconium state, right? So these are some abnormalities that occur, right? अब next thing आती है amniotic fluid index. ठीक है? If we talk about the key concept, हमें पता है कि at term 600 to 800 ml of amniotic fluid होता है. जैसे जैसे post dated pregnancy होती है, वैसे वैसे amniotic fluid का composition amount is reduced. ठीक है? So basically AFI calculate कैसे होता है? AFI is calculated with the help of ultrasonography. ठीक है? जो normal AFI होता है, it is 5 to 25. If AFI is less than 5, it indicates oligohydramnios. And if AFI is more than 25, it indicates polyhydramnios. ठीक है? But if you talk about oligohydramnios in terms of volume, it is less than 200 ml. और अगर हम polyhydramnios की बात करें, if we talk about polyhydramnios, the volume is more than 2000 ml. ठीक है? If we talk about ultrasound में हम 4 pockets में divide करते हैं amniotic fluid को. अगर उसकी हम single largest pocket की हम length देखें, ठीक है? It should be like between 2 to 8 centimeters. अगर जो single largest pocket होती है at the time of ultrasonography, जो if it is less than 2, it indicates oligohydramnios, and if it is more than it indicates polyhydramnios. ठीक है? ये abnormalities होती है कि normally तो term में 600 to 800 होना चाहिए. अगर हम AFI की बात करें 5 to 25 होना चाहिए. 5 से कम है अगर AFI तो मतलब oligohydramnios है, and more than 25 है, that indicates it is polyhydramnios. ठीक है? और दोनों ही abnormalities है, right? If you talk about the next, ठीक है? So ये दोनों ही क्या है, वो abnormalities है. So this is all about this video. In the upcoming videos, so this was all about this video. In the upcoming further videos, we will be discussing in detail regarding oligohydramnios and the polyhydramnios. Okay, like what are the causes of oligohydramnios and polyhydramnios and how it is being managed, right? So that's all for today. I hope this video was informational for you. Subscribe for more. Thank you.